Vitamin D is a fat-soluble vitamin that plays a crucial role in maintaining overall health. It is often referred to as the sunshine vitamin because our bodies can synthesize it when our skin is exposed to sunlight. This article will delve into the benefits of vitamin D, its food sources, the best time for sunlight exposure, the consequences of vitamin D deficiency, and potential issues related to vitamin D overdose. Benefits of vitamin D. Bone health. One of the primary roles of vitamin D is to facilitate the absorption of calcium and phosphorus in the intestines. This is essential for maintaining strong and healthy bones. Immune system support. Vitamin D is involved in regulating the immune system and can help the body defend against infections and diseases. Mood and mental health. There is evidence to suggest that vitamin D may have a positive impact on mood and may reduce the risk of depression and other mood disorders. Cardiovascular health. Adequate vitamin D levels are associated with a lower risk of heart disease, as it can help regulate blood pressure and reduce inflammation. Cancer prevention. Some studies indicate that vitamin D may play a role in reducing the risk of certain types of cancer, although more research is needed to confirm these findings. Sources of vitamin D from food. Fatty fish, salmon, mackerel, and tuna are excellent sources of vitamin D. Egg yolks. Egg yolks contain vitamin D, although the amount can vary depending on the chicken's diet. Mushrooms. Some types of mushrooms, like shiitake, can provide small amounts of vitamin D when exposed to ultraviolet (UV) light during growth. Best time for sunlight exposure. The body can produce vitamin D when the skin is exposed to sunlight, specifically UVB rays. The best time for sunlight exposure to promote vitamin D synthesis is during the late morning to early afternoon, generally between 10 a.m. and 3 p.m. The skin on your arms, legs, or back should be exposed, and it's essential to avoid excessive sun exposure to prevent sunburn and skin damage. The amount of time needed varies based on factors like skin tone, geographic location, and time of year. Generally, 10 to 30 minutes of sunlight exposure a few times a week is sufficient for many individuals. Consequences of vitamin D deficiency. Bone health. A lack of vitamin D can lead to reduced calcium absorption, potentially causing soft and brittle bones. In children, this condition is known as rickets, while in adults, it's called osteomalacia. Immune system impairment. Vitamin D deficiency may weaken the immune system, making the body more susceptible to infections and autoimmune diseases. Mood disorders. Some studies suggest a link between low vitamin D levels and an increased risk of depression and other mood disorders. Chronic diseases. Vitamin D deficiency has been associated with the higher risk of chronic diseases, including cardiovascular diseases, diabetes, and some types of cancer. Issues with vitamin D overdose. While vitamin D is essential, excessive intake can lead to adverse effects. Hypercalcemia. Too much vitamin D can cause the body to absorb too much calcium, leading to high blood calcium levels, which can result in kidney stones, digestive issues, and weakened bones. Kidney and heart problems. Excessive vitamin D can strain the kidneys and lead to kidney damage, as well as increase the risk of heart-related issues. Nausea and vomiting. Overdosing on vitamin D can lead to gastrointestinal symptoms, including nausea, vomiting, and loss of appetite. Weakness and fatigue. High levels of vitamin D can cause muscle weakness and fatigue. Conclusion. Vitamin D is a vital nutrient that supports various aspects of our health, including bone health, immune function, and mental well-being. Inadequate vitamin D intake can lead to deficiency-related health issues, while excessive intake can result in adverse effects. Achieving the right balance, either through sunlight exposure or dietary sources, is essential for maintaining optimal health.